Hello, everyone. We're going to get ready, or we're going to start in 1 minute. So we'll start in 1 minute. Okay, my watch says 4, so I'm going to get started. Welcome, everyone. This is week 2 of the IBC 793 CP2 course. Glad to have you all here. Hopefully we'll have a good turnout today. I hope that the link is working for all of you. I see a good crowd here. We have about 12 people joining the webinar. And there are about, I think there are about 50 students in the class, so it's a good sized class. Okay, so I'm going to get started with my slides, and then at the end I've got an example of a project charter that I'll go through. Okay, so just some reminders about assignments that are coming up. So I've seen that some of you have completed the online modules with the IHI, that's the Institute for Healthcare Improvement. Those are due this Sunday, September 8th. So remember, there are 4 modules that you want to complete. You'll get the certificates once you complete the modules, and then you'll combine all those certificates into one PDF, and then just submit that through Canvas. And then the quiz number 2 for the quality improvement article, that is due September 15th, so a week later. And then that same day is also when you need to take the knowledge quiz, the knowledge test. So by the time you take the test, you should have read 2 QI articles and completed 4 modules, and you should have a growing base of knowledge about what quality improvement is. And I believe that test you can take multiple times. And then the week after that, September 22nd is when the project charter is due. Okay, any questions about these upcoming assignments? You can send a question through the chat, or you can unmute yourself. Anything that you want to know about the assignments?
Hi, Dr. Martin. I think you mentioned you'll talk in more detail about the project charter. I just had questions about, defining the process versus the champion versus the team leader. You'll go through that at the end.
Yep. Yeah.
Yep.
Good questions. I'll go through all that, Allison. Thank you. Okay. Any other questions? Okay. Great. Okay, so just some updates. So as I mentioned last time, we're doing something new as core faculty. We're trying to distribute the number of advisees evenly across the entire CP2 course. So we're making new assignments for advisor/chair people. So your advisor/chair, this is someone who's a member of the core faculty who will be both your advisor and your chair starting in CP2 all the way until graduation. And one reason we're doing this is we're trying to make sure that that your advisor or chair is a really good match for you, but also that they have the bandwidth to help you as much as possible. In the past, we've had some faculty that had way too many students, and we're trying to correct that. So we just finished the assignments. I just sent out an email to all of my new assignments. you should receive an email this week from your new advisor chair. If you haven't received one and you're feeling kind of nervous about it, just send me a quick email and I'll see if I can find out who that person is. So again, these are new assignments. So the advisor you've had in the past, for the most of the time, it's going to be the same faculty member, but there are several instances where you're going to have a new assignment. So just look out for that email. You still need to find committee members who are going to be a part of your culminating project committee. That's still going on. Another update is grading groups. So we have two other co-instructors, Dr. Murphy and Dr. Suma. They're helping me to grade everything in the class. And so what I've done is I've broken down the entire student population for this course into 3 groups. And one thing that I'm going to try to do today before the end of the day is email you your new grading group. So this will be one of the 3 of us, one of the 3 instructors who will be in charge of grading all your assignments in this course. This person will also be the one that you'll sign up to do consultations with. So I'll try to email you your grading group by the end of the day. So let me talk about consultations. So consultations, I believe there are 6 consultations in the semester, and they take the place of a webinar. So when you see consultation for that week in the Canvas shell, that means there's no webinar. And so instead, we're spending that time basically having open office hours where you can sign up with whoever is your assigned grader, and you can have 15 to 20 minutes talking about your project or about an assignment that you need feedback on. Those are not open yet. I'm hoping I can get those consultation slots open by tomorrow. They're going to be at different times throughout the week. So once I open up the consultation sign up, and I'll send out an email with all the instructions about how to access it. Once you sign up for a consultation, or once you look at the schedule rather, if you see that there's a slot that doesn't fit your schedule, that's okay. What I would recommend is you send an email to your grader or to your assigned instructor, and just let them know that the schedule doesn't work for you, and if you can sign up for a time outside of that schedule. And it's really up to them if they want to do that. So look out for that email with all the instructions about consultations. The first consultation week is next week, which is week 3. And then, like I mentioned, we have about 5 to 6 consultations throughout the semester. It's a really nice opportunity to get more feedback about your assignments and about your writing. I would say that most students enjoy them, especially if writing is not a strength of yours. It's a really good opportunity to help improve your writing ability. Okay, so those are some of the updates. Any questions about anything that I've said right here? Okay, great. If you have any questions after the webinar, please don't hesitate to email me. I want to be as clear and helpful to all of you. Okay, so I see one question. Oh, no. Okay, so yeah, so one confirmation, yes, there is no webinar next week. It's going to be consultations.
Hi, can you hear me?
Yes, is it Sasha?
It's Shasta. Sorry,
Shasta.
I'm driving, but greetings. Yes.
I can hear you, yes.
So I emailed Dr. Dr. Murphy was the one who responded to me, but I submitted for the Q1 through 101 through Q104 regarding the QI certifications, but I was unable to merge the 4 certifications without paying for Adobe. And so I contacted IT, ASU's IT department, and they didn't really understand the directions either. So what I did was basically I used the snipping tool to kind of copy the verification to show that I'd received the certification, and then I saved it all on a Word document and changed it to PDF, and then submitted it to you all. And I'm hopeful that I get credit, because there was just no way to do it where I'm combining PDFs without paying for Adobe. And ASU said that they are not covering the cost for Adobe.
Shasta, that is a brilliant solution. That would definitely work. Yes, you can take snippets or copy the images of those certificates, put all 4 of them onto a document, and if you can, turn that into a PDF and submit that, and that would be just fine. That's a great idea.
Okay, perfect, because I spent hours. I was like, what to do? And so, but we figured it out, and I emailed you or whomever is going to be my grader, and I did put it in my comments when I submitted the assignment, and put it in the comments along with the case number from IT sharing what I did, because that was all I could do to do a PDF.
Great, great. Yeah, go ahead and do that. That will work. For some of you, if you really want to combine PDFs, there are some free programs available online. If you just Google for free online PDF combine, just be aware that some of those sites, they work just fine, but they have a lot of those kind of fake clicking buttons. So just be aware of that. My recommendation would be to do exactly what Shasta did. If you still have trouble with that, just send me an email and we'll figure out something else.
Thank you for that suggestion. That's a good idea. I just put the 4 separately in there, so I'll go back and try to combine them.
Yes, yeah. Okay, other questions, comments about these updates? Okay. Okay, I'm seeing a comment come through. Okay, Lawan is asking, are we able to print the certificates and then upload, scan them? Well, so IHI should send you an electronic certificate in the form of a PDF. So you don't have to print them off. You can just save them as a PDF. And then you can do what Shasta did. You could copy those images and put them into a Word document, or you can combine them if you have the right program. So you don't have to print them off. Good question. Okay, so for today, we're going to be talking about the project charter, and I'll go through details on how to go through each section of the project charter and how to put together your team. But before we do that, let me just review what we talked about at the last webinar. So in the last webinar, we talked about all the assignments, and remember, this course is all about developing your project and helping to get your project launched, moving forward, get you collecting data, and then prepare you for CP3, where you write up the results and the discussion, and basically put together your final report, your final paper, and then you graduate and you get to get your degree. So this is an important course, and it's one where a lot of students struggle because it is a little writing intensive, especially the literature review. For a lot of you, you bring a lot of skills from your clinical and your management background, but the kind of technical writing and quality improvement methodology that we go over in here doesn't come naturally, or it may not be a part of your impressive resume. So that's okay. That's why we've designed the course this way, so that you can get that QI knowledge and develop your technical writing skills. So we talked about those assignments the last time we met. I also talked about the MyDBH tasks, which are separate from this course. So that includes things like getting approval of your proposal from your advisor and your committee, and then also the final task for MyDBH in CP2 at least is to show that you've collected your data and that you're ready to write up your results in CP3. So all of those tasks are on MyDBH, but they're not they're not tasks that I track or grade in this course in CP2. We also talked about the difference between improvement and research. Remember, research is all about generating new knowledge and testing hypotheses, trying to advance the science of a particular field or area of interest. These are the kind of projects that you see written up in research journals, that you see presented at conferences. They're peer-reviewed and they're disseminated, and they're very important for helping to create new interventions and to see if interventions work in different settings. Improvement is different, because with improvement, we're really taking a solution-based approach to try and improve health outcomes, a particular workflow or protocol, and we're doing it in a pretty quick and sometimes dirty fashion, because there's not as much concern about bias or about testing hypotheses when it comes to improvement. There's really not a lot of innovation in quality improvement work, and I say that because most of the strategies that you all are going to test, or not test, but rather use, are pretty common sense, or at least they've been tested in a lot of other areas. So just keep that in mind when you're working on your literature review and your methods paper, that there's quite a difference between improvement, the kind of project that you're doing, and traditional research. All right, the project charter. So what's the purpose? Well, one purpose is to keep the whole team on the same page, to start off on a good foot, to make sure that there's clarity about the aim and the purpose of your project. It's also to organize all of your thoughts. Oftentimes, I'm not sure about you all, but when I go to a meeting, we're often throwing thoughts up against the wall. We're seeing what sticks, and sometimes we forget to take notes. So the project charter is a nice way of putting down on paper the outcomes that you expect for your project, who's a member of the team, the timeline, and it's a nice way of recording all of that info. It also helps to create anchors for the entire project so that it's not getting too big or too small. You're able to clearly identify the scope of your project right away, and then you can build in measures or features that help to make sure that it doesn't get bigger than it should be or too small. And then finally, the charter is helpful for getting buy-in from other people. If you put together a charter, it's a great thing to share with others so that they can clearly understand what you're trying to improve in the clinic or hospital where you work. It's a pretty quick report. It's not even a report. It's a pretty quick charter that's only 2 pages. Many of you are familiar with SMART goals, so this is going to be just a brief overview. But for some of you that are not familiar with it, it's an important strategy to use when you're designing the goals for your project. So the SMART, of course, is an acronym, and the S stands for specific. Is the problem that you're trying to improve clear and well-defined? Can you easily describe that problem to someone else? Imagine you're in an elevator, you've got 10 seconds to describe the problem. Can you do that effectively? And can anyone with a basic knowledge of the field understand it? If not, then you may be using too many technical terms, or the problem may not be as clear as you think it is. That's a nice litmus test. If you can explain it to your grandmother or your grandfather or your partner or a kid, and they can understand it, then you've done a really good job of communicating your problem. Measurable. Can I measure what I want to improve? Is that data available to me? Some students have great projects. They've clearly identified a problem in the healthcare system where they work, but unfortunately the data that they need is just not available to them. Maybe it's not being collected, or it's just not feasible to collect it. It's too hard to do. So it's not just about can you measure the outcomes of your project, but is that data accessible to you? Do you have the ease and the authority to access it? And if you don't, do you know someone who does? Do you have an information systems manager who can get that data for you? Hopefully you do. Achievable. Can you complete your project within the time parameters? One thing that my advisor, my chair, told me when I was in my doctoral program is that your project is not the final project of your life. It's not supposed to be the grand lifetime achievement. It's really just an opportunity to apply and practice some skills and some knowledge that you learn during your doctoral program. So make sure that you're picking a project that is feasible, achievable within a semester or two. Results focused. Are there clear outcomes? In other words, are you able to clearly identify whether the project has been a success or not? If those results or if those measures are not clear, then you may have to go back and clarify what they are. In other words, how will you know when the project is done, or how will you know when it's been successful or not? And then finally, the T stands for time bound. Can you complete it during your internship? That's very similar to achievable. So I just want to emphasize how important it is to pick a quote unquote smart project, because one thing that I noticed a lot of students struggle with is creating a project that is definitely an improvement project, but one that is clear enough and that will have a definite impact on the system. So I recommend wherever you're working, wherever you're doing your project, to talk to the staff, the clinicians, the administrators. If you're very familiar with the place where you're working, you probably have a sense of some of the limitations, the bottlenecks, the choke points, the areas of improvement already. But if you don't, you'll have to do some homework and start to talk to people about what things do they get frustrated with? What things, if they could wave a magic wand, could they make better? Or what are some of the current initiatives or aims of the system that resources are being put into? In other words, there are some places where they've created a new initiative, but they're just struggling. They're just spinning their wheels, and perhaps you can come along and generate some new ideas for how to improve that. Okay, one more ingredient that I like to add to the SMART acronym is meaningful. Is the project meaningful to you and the stakeholders? Sometimes you'll think of a project that you really like. It just seems to scratch this itch inside of you. Maybe because it has something to do with a particular patient population that you care a lot about, or it's related to finance and you're really intrigued by finance, but it may not be very meaningful or important to the stakeholders. That's an important thing to think about, because you should pick a project that you're interested in, but that also aligns with the interests of the stakeholders, because you'll need that support from them when you're moving forward with your project. If you find yourself moving toward a project that you're not interested in, but that the stakeholders, that the system is very interested in, just keep that in mind, because you may have to suspend your own interests in order to get that stakeholder support and buy-in. Okay, I see one comment. Okay, so Amber's asking, is it okay to pick a project that the stakeholders want, even though they know there is not enough time to completely do the improvement, but can produce improvements over time? Yes, just be careful. As long as you're able to collect data within the semester or two that you're working, you can collect enough data that can show whether there has been an improvement or not. Even though the project may not be completely done by the time that you finish your internship, as long as you have that data, I think you can move forward with that kind of project. Sarah's asking, how long is the typical period of data collection for baseline and then after implementation? So it's usually shorter with improvement projects compared to research. I would say 4 weeks. Yeah, you should probably get about 4 weeks of data. And remember, with improvement projects, you're checking that data on a regular basis. I would recommend every week. So at the end of the week, look at that data, create that run chart or that line graph and see if it's going up or down, and then make an adjustment. Try something new to see if you can make it go up. So I would recommend 4 weeks or 1 month worth of data.
Dr. Martin, how much data do we need? How many subjects? Different from research, so that's an interesting question about that.
So the question is about how many subjects do you need? You don't need a lot. It's hard to give an absolute number because, of course, with research, the sample size, the bigger the sample size, the better, because it controls for variation. That's not as important in improvement. I would say, and this is not going to be a satisfying answer, but enough subjects or patients or participants that you're able to gauge if there's been an improvement. And that's definitely going to be more than one.
That goes along with what the IHI resources also said in the modules.
So did I understand you? You said that's consistent with the modules? Okay. I think that's Teresa Nez asks, so the project does not have to be a chronic medical diagnosis and mental health diagnosis, chronic pain and depression. So this is one question that I think some of the faculty disagree on. So you may have an advisor that says, yes, you have to have a chronic, you have to have a medical variable and a mental health variable because you need to demonstrate integration in your project. However, I think we're moving toward where the very fact that you're doing a project in a clinical site, I think that demonstrates integration. So at this point, I think I can safely say you do not need both a medical and a mental health variable for your project. Sarah is asking 4 weeks for baseline and 4 weeks ongoing. Yeah, thank you for that question, Sarah. So yes, you should have data before the implementation of your particular solution or intervention so that you can show if there has been a change. And if you can get 4 weeks before and then 4 weeks after, I think you would be in good shape.
I have a question. Okay.
Yes.
So this is Shasta again, and I'm working in a primary, I'm gonna be basically working side by side with a primary care physician, offering some brief interventions. Now, when I first started the project, my thought was I wanted to focus on some metabolic concerns related to people who have first episode, whether it's first episode of bipolar disorder or psychosis or whatever it may be, but that does not seem to be the population. The primary care office that I'm working out of, it's integrated or co-located with a behavioral health clinic. However, the primary care does not, she sees both people who have SMI diagnosis and those who do not. And so I guess I'm going to be providing like assessment tools using like the PHQ-9s, GAD, and like overall impressions of the person regarding their behavioral health. But I was also under the impression that I had to do a medical and a psychiatric diagnosis. So I had then transitioned my project to focus on how is BMI affecting depression, or like the correlation between BMI charts or the BMI numbers and depression. So at this point, it's like I'm not going to be seeing recurring patients. I'm going to be engaging with pretty much all of the people that she's seeing and offering this because the clinic itself is not doing it because they don't have the staff to do it. And so obviously here I am, the intern, and I'm able to do this, and they want to take take advantage of it so they can monitor it. But I guess I'm gonna need a little bit more individual support in understanding how I can make this work for me and the organization that I'm working for.
Yes, great point, Sasha. Let me respond to two of them. So yes, just to confirm and reiterate, you do not need a medical and then a psychological mental health variable. We are moving away from that because for some of the sites where you're working, that's just not important to them. They have problems and issues that they need to be addressed. So the second comment that I'll make for your particular site, and this comment may be helpful for other people in other similar situations, is my recommendation would be to take a step back and to look at the process of this integrated care service that you're participating in, and to look at some areas of improvement. Look for areas where there's not an efficient use of resources or time, where maybe there's some bottlenecks. Look at the referral process, like look at how the physician is sending referrals to you and the other consultant. Look at how the screening is being done. Could it be improved? And think of all these care pathways and protocols, and pick one. Pick one that's important to the clinic and see if there's a way that you can improve it and make it even better.
Okay. That helps me because the process is non-existent. Like, they're basically don't have the time to do it, not enough resources for staff. And so I was very focused on how can I improve depression, like with this patient, and say that the BMI score changed or the depression score went down. But it sounds like even though I'm clinical, I can still look at processes.
That's exactly right. Yeah, you're looking at very important clinical processes. So you're looking at how do we identify a patient, and then maybe how do we document that assessment information? How is that assessment or screening communicated to the rest of the care team? How is a treatment decision made? There's so many steps along that care pathway that you can look at to see if they can be improved. Now, you made Shasta, let me make another comment. You made an important observation about how there is no existing protocol. And a lot of you might be working in places where you are the integration. You're the first person to have ever done anything integrated before. And so you may not have any baseline data. And that's okay. That's not a major issue. If you're looking at a data point or a measure where there is no baseline, or maybe the baseline is just 0, that's okay. Just be clear about that. Be clear that this is a new protocol, be clear that this is that your improvement project is the implementation of a new protocol. Okay, there was a question from Allison. If we're doing a group intervention, how many cycles of the group would be best? So Allison, just reading that, at face value, the group intervention or a question about the group intervention, it sounds like it may be more along the lines of traditional research. So as far if you were to take an improvement approach, there is no right number of group visits or cycles that you would need. If I were to pick a number, I would probably say maybe 3 to 4, but just be sure that you're taking an improvement approach with the group visits. And then Amber her comment. It says, my stakeholders want an RIE to improve process flows, improve communication, free up time. Does this seem too small or just right for the time frame? Well, at face value, Amber, it does seem a little too big. There's certainly a lot there. Yeah, I would recommend being careful about the scope of that project and see if you can just pick one piece of that. Okay, I'm seeing some great questions and comments from people. Let's see, I'm seeing one more. Oh, okay, it's just thank you. All right. So let me move on. And let me talk about each section of the project charter. So I'm glad that you're thinking about your sites, about your projects. I saw another comment from Monica. She says, I'm working toward bringing primary care into a behavioral health system. Oh, that's interesting. There is a current team that works with people transitioning from inpatient psych or incarceration back into the community. My plan is to work with this team to increase the number of successful primary care referrals appointments during that transition time. Monica, that sounds like an ideal improvement project. I mean, you have a clear outcome, which is to increase the number of successful referrals or appointments. I would say referrals, and just be careful about how you define referral appointment. Does that mean completed referral, or is it just one that is submitted into the system? But that kind of project, that's the kind that we're looking for. So if you like Monica's comment, be sure you copy and paste that, because that's a pretty good one. Okay, so the project description is the first section of the project charter. This is where you're describing the project. You can say a little bit about the history, where it's coming from, a little bit about the problem. This is a nice summary of the entire project. And then you clearly state the purpose. So, something along the lines of, the purpose of this project is to improve or decrease or increase, ABC, or just A, something like that. And then what to expect as a result of this project. And that's where you clearly say something like, the success of this project, or the results of this project will allow us to, ABC, something like that. Okay, Teresa is asking, can you explain outcome measures versus process measures? Yes. So most traditional research looks at outcome measures. So looking at symptoms, functioning, a lot of health outcomes, as well as maybe, I guess you could look at, it's usually the patient outcomes, because that's kind of like the end point. That's like the end of the treatment, like the outcome of the entire treatment. Whereas process outcomes, those are more focused on the innards, the mechanics, the actual process of the intervention, like the operations behind it. So that would include things like Monica's example, like referrals, or maybe the number of team meetings, the number of mental health diagnoses, or particular prescriptions. They're not the end result of the treatment, but they're an important part of how the treatment is being done. Okay, the next section is the project overview. This is where you go into a little bit more detail. So first you do the summary, and then you go into more detail. You spend some time talking about the problem, and I recommend adding some numbers if they're available to you. So if you can quantify the problem, this is where you would do it. You can also go into the history of the problem. Sometimes people's solutions in the past are what have led to the problem of the present. And so you can describe that a little in this summary. After that, you're going to talk about the desired outcomes, what you hope will be the result of this project. And I would recommend creating subheadings for each outcome that you want to track. You probably don't want to have a lot of outcomes because it makes your data collection, your data analysis, your data everything a little bit more complicated. So I would recommend having maybe 2-3 outcomes at most. The next section is the benefits. This is important because you should be able to make like a business case for why this project is going to be important. You can talk about improving patient care, or maybe improving the financial viability of the system where you're working. Okay, Allison is asking, can this be the same similar project as our internship project, or does it need to be a whole different one? Oh boy, good question. I don't know if I have an answer for that because I don't work with the internship coordinator or the supervisors very much. So I don't know much about the internship project requirements. If anyone has an answer to that question, please go ahead and you can send a message through the chat. I may have to follow up on that and ask Dr. Mackey, the internship coordinator. I mean, personally, I don't see a problem with that, but he may have some concerns. So the question was, can your culminating project be the same as your internship project? And my very unsatisfying answer is, I don't know. Okay, so someone said, Dr. Goodman said to make it separate. Oh, okay, so that may be the answer. I'll try and see if I can find a final answer on that. Oh, I'm sorry to confuse you. I hope I can get a clear answer on that. I'm hearing, it looks like it should be separate. Okay, so that's the project overview. Okay, I'm seeing lots of comments. I was informed that the internship project was more simple and not as complex. That may be the case. I'm just not very familiar with it. Can you send an email out to make an announcement with your confirmed answer? Yes, I can send an email out. Okay, and then it looks like Monica was sending some more information about her project. For my project, the outcome measure will be the number of completed primary care referrals. Okay. Process measures might include the amount of time between discharge, yeah. The balance measure might include staff satisfaction, other tasks that may take longer. Yes, I think those are all good process measures. I was told in my internship that we should use things that might help in our CP project. That makes sense to me. That seems like good advice. Okay, so it sounds like you should, oh wait, Dr. Joseph encouraged us to use the same project. Okay, so I definitely need to find a clear answer on this. So to be determined, I will find that out for you all. Okay, so like I mentioned, the problem summary, you're going into more information and you're particularly focusing on the site. You can provide some general information about the importance of timely referrals or team-based care, but it's really contextual information that you want to provide here. It's also important to talk about the impact on the staff. So yeah, it's affecting the system as a whole, but talk about particular team members or patients that are being affected by long wait times or by inefficient communication between providers. Then for desired outcomes, these are just a clear description of what will change as a result of the project. It's nice if you can quantify it, but it's not necessary. So once you're done with that section, you move on to the timeline. Now the timeline is organized by the acronym DMAIC. This is pronounced DMAIC, and this is a 6 sigma term. This comes from process engineering. There's a lot of history behind this term, but it's the one that we use for organizing your timeline. So the project charter includes this acronym, and this is basically just going to give you some milestones that we want you to keep. Now the dates that you pick for each phase are really up to you. Just keep in mind when you're going to complete your internship, and keep in mind what seems feasible in terms of completing it. The define phase is where you define the problem. That should hopefully that won't take too long. The measure phase is where you hopefully can quantify it. And these are not things that you do during the project charter These are things that you are anticipating doing after you have submitted your project charter. Analyze. This is where you're looking at the root causes of the problem to find out what are the drivers, what are the contributors to the problem. Improve. This is where you actually test out your strategy. You implement the solution and see if it works. And if it doesn't, then you look at the numbers and you try something else. And then control. This is where you have built in strategies that will help to make the solution sustainable, make it long lasting. Oh, and let me just say that the example, there is an example in Canvas, and it does have, I believe it has an example timeline. Project scope, I've talked about this before. Oh, let me just see, I've missed some comments. Yes, yeah, I'll get a clear answer on that. And then Teresa asks, are we going to do a literature review on this project? Yes, that is one of the major assignments in this course, is a literature review. And I'll talk about that later in the future. Project scope. It's important to avoid project creep. Project creep is when other people get excited about your project and they want it to grow, they want it to include things that they're interested in, and before you know it, you're doing a much bigger project than you anticipated. The project charter helps you to keep that all in check. So you want to identify things that are within the scope of your project, and this is typically just rehashing what you've already said in other sections here. More importantly is you're identifying things that are out of scope. So you might say something like, we are not looking at referrals to specialists, or we're not looking at wait time for procedures, or we're not looking at billing for ABC. You're kind of anticipating what are some project ideas that are kind of on the perimeter of your project, and you're creating a boundary saying we are definitely not looking at these. Hopefully that section won't be too hard for you to do. Okay, then the project team. So the team lead is you. You are the team lead. The team lead is you. The project champion, this is someone who is providing emotional support, someone who's excited about this project and is cheering you on. That's the cheerleader. The process owner is the day-to-day worker within that process. Whereas the process manager, you have to go up a level. This is the person who has authority or who supervises that process. Now sometimes, especially in small clinics or small systems, the owner and the manager might be the same person, or the champion and the manager might be the same person as well, and that's okay. This is really just an opportunity to identify particular team members. The stakeholders, this can include a lot of people. It can include maybe a patient advocate or someone in the administration office. And then finally, the signatures. So you do need real signatures from each individual that's listed on the project charter, because we need to have documentation that there is support from your site to move forward with this project. Remember, the project has to be meaningful. It has to be aligned with the current missions and aims of your system. And if it's not, then you may struggle to get support to move that project forward. Okay, so that's the end of the slides. Let me end that and go to the example. All right, here's the example, and this is available in the Canvas shell. If you just go to week 2 webinar or week 2 project charter, it should have my slides as well as the example and then the template. And the template is basically the same thing but without all the example. Okay, there's a question. Okay, Amber is saying, my project is on a military base. There are several people who are involved, but it's difficult to get signatures from all stakeholders. How many signatures are needed? Let me scroll down to the bottom, Amber. I can't remember. Okay, so it says 3. So one is the process owner, and then the project champion, and then the team lead, who is yourself. So it's 3 signatures, but one of them is your own. So hopefully you can get the project owner and the champion at least. You don't need a signature from like the CEO or the president, unless they're the champion, then you could certainly get them to sign it. What is the difference between the stakeholders and team members? So the stakeholders, they're affected by your project, they care about it, but they're not part of the team. They're not going to be, looking at the data or maybe helping you come up with solutions or helping to complete certain tasks. They're not going to be helping you much with the project. The team members, hopefully, they will be helping you with the project. Okay, so this example is pretty self-explanatory. You can see that I put a name for the project, and then the name of the clinic, and then the process. This might be challenging. I recommend just clearly stating the process. So if it's like Monica's example, completed referrals to, I can't remember what the referrals were for. You can just put that, completed referrals to behavioral health consultant, or you could also put something like completed screenings as well. It doesn't have to be fancy. Okay, you can see a project description, and all of this follows the things that I put in the slides as well. So the desired outcomes for this project are to increase the number of completed screenings for annual and new patient visits. So that's just one outcome, but this project it could take a lot of effort because we're focusing on something. We're working with a busy clinic. We're maybe creating a new protocol and testing it out. So even if it's one outcome, there could be a lot of work involved with just that one outcome. This project will definitely benefit the clinic. It's going to be helping to identify patients at risk for substance use problems and connecting them with support and/or treatment. The completion dates are pretty feasible. At the same time, they move along pretty quickly. So it shouldn't take too much time for me to define the problem. Oh, I'm sorry, I forgot to add one more thing. In your timeline, if you will please, include the core activity with that phase. So for me, defining the problem really just includes interviewing more staff, so I have a better sense of what's going on. And then measuring it, that could include going into the clinical database, the record system, and pulling out some data. That might be a little challenging for some of you. For others, it's not going to take too much time. So just include a core activity here so that you can help to clarify what you're going to be doing at each stage. Okay, Allison's asking, is our timeline this semester only or next semester as well? It could go into next semester. If you're a clinical student and your internship is 2 semesters long, I could see you spending time in the next semester implementing your solution, the improve phase right here. That could definitely happen. For the management students who have 1 semester, you'll have to move along a little bit more quicker. And then Pamela is asking, my project is being completed by multiple clinics. In the clinic name, can I place the ACO, or am I going to write out every clinic? I think it's okay if you put the ACO. That's fine. Shasa is asked, if I am completing PHQ-9 and GAD along with substance abuse and tobacco screenings, Would I list all of these or just choose one as a primary? If you're collecting data on all of them, then you should list all of them. Good questions. Okay, I'm coming to the second page, project scope. So here it clearly says that the primary objective of this project is to ABC. And then here out of scope, it says we are not addressing any problems related to other screening measures. And then it's got my name, and then all these other people whose names I made up. So that's my team. Here are the stakeholders and the project team members. Okay, so the project team members, sometimes this will include the champion or the manager, the process owner, and sometimes it won't. Sometimes it'll just be other staff who can provide help to you. So for example, I put down the clinical records information specialist. That's going to be someone who's a part of the team. They may only be helping you to access data, but they're definitely a part of the team. Without their help, you wouldn't be able to complete it. And then I've got the signatures down at the bottom. Okay, whew. All right, that's the project charter. So there's some good work that goes into it, but hopefully by going through this activity, completing your own charter, you'll have a good sense for what it means to design a project, and then to start to think about how to manage that project, how to manage your own time, how to manage your team, and how to make a plan moving forward to be successful in your improvement project. So everything should be on the Canvas shell. If you have any questions about the project charter, please email me. I'm happy to answer them. If you want any early feedback on your charter, you can send it to whoever is your grading instructor, whether it's me, Dr. Murphy, or Dr. Suma. We can give you early feedback on the charter to make sure you're headed in the right direction. You will need to have real signatures in order to get full points on the charter. But once you get full points on the charter, then you'll submit it to your advisor/chair, and they'll look at it, and hopefully they'll love it, or they might give you some additional feedback, maybe some stuff that we missed. That is not an uncommon thing to happen. But hopefully they'll approve it, and then you'll be able to move on. Let's see, Monica, it looks like you're sharing the screen. Did you want to point something out? Okay. I thought maybe you were proud of your charter. You wanted to show it. Okay, so I don't see any more comments or questions. We're out of time. Oh, I'm seeing one question from Allison. Oh, I missed two questions. Monica asked, is it okay to start collecting baseline data before the project has been approved? No. Actually, that is okay. Yeah, I mean, you will need approval from your advisor to move forward with the project, but you can start to collect some baseline data. I think that would be fine. Just be aware that there is a remote chance that your project could be scrapped. That is possible. Oh, yeah, no problem, Monica. Then Allison, just to clarify, is this a project we are exploring only in theory or one that we will implement? So this is a real project that you will be implementing. This is your culminating project. This is one that will hopefully improve your clinic or wherever you're working, and then will allow you to graduate at the end. Diana, since our committee chair may have changed, do we still proceed with contacting our potential committee selection? I was told this class we discussed this, however, this may be incorrect. Yeah, you definitely are reaching out to potential committee members and inviting them to join your committee. Your advisor/chair will have to approve whoever you're inviting. But yes, that is something that you can be doing right now. Okay, all great questions. Have a great rest of the week. Let me know if you have any questions. Good to see you all. Bye-bye.